My talk at TEDx will be about aspects of evolution. Evolution is the only theory, the only theoretical thing that exists in biology, and as it turns out for my life, my essential big niche is to combine evolutionary information and machine learning. In some sense, I discovered for me how useful evolution is, and that is the only thing, but evolution is not a theory in the sense of physics. Everything about biology is individuality. Is you have to get rid of this idea that there is an equation that explains it. What biology is about the individual molecule, the gene. That protein is special. That protein has a certain name. For a biologist, is very, very happy to deal with a bunch of names, as you know. As a physicist, I'm not happy. I'm happy to deal with equations, but I'm not happy to have everything have its own name, because that is too confusing for me. Ideas are the important thing. So I had to evolve to become a biologist and to understand that for life sciences, individuality is the important thing. And I believe I have come a great way. What is the impact of computational biology onto biology, experimental biology, onto society? Well, one way of looking at it is that there is not a single drug that comes on the market today that has not used computational biology first. So that is one big impact. Every experiment starts with a search, with a database search, and that is a field to which we have contributed concepts, ideas. The most important contribution, however, for our group, I believe, is really in the combination of evolutionary information and machine learning. Essentially, the question pertains to open access. Why did I start with, in fact, developing one of the first resources in molecular biology on the internet, predict protein, in 1992 with Chris Sander and Reinhard Schneider, and at the MBL in Heidelberg. And ultimately the answer is, imagine in 1992 there is no internet as you know it today. There is no Google, there is no... But what we have is a bunch of programs that... There's a suite of programs for which you pay a lot of money, and then you can run, and you can, for instance, predict secondary structure. So the first server was about analyzing sequences, so finding, again, we're back exactly to what I said. You start with a sequence and you ask, in today's databases, what is it that I know of other proteins that are similar to that one? Well, that's a standard. We did a standard alignment program. We used BLAST. We used then something that those days was much better called Maximum, developed by Chris Sander and Reinhard Schneider. And in fact, that gave a better answer to what is in the database that is similar. And then we predicted secondary structure, and all of that was freely available to everybody. Nobody had to pay anything for it, and was run on top of our machines. Why did we do that? For me, essentially the point was that my ultimate point was, or my ultimate argument to myself was, if I really care for my method, if I really believe that I have the best methods in the world, and I did believe that, and actually the following years clearly proved it was true, then I have to, in fact, give my method out there for others to test. I have to be totally open about it. The ultimate proof of the usability of that is by making it available in a way that is as simple as possible. Personalized health or personalized medicine is something that is important to us. But so you may imagine personalized medicine, one way in which it's sort of sold in the public is there is a drug for everyone. We currently have 25 drugs that are new every year, approved by the FDA in the US. That's one example. In Europe is not more than that. So we immediately sort of see that these numbers, I don't know, 85 million people in Germany alone, 4 million in the US. So these 25 drugs are not enough for this diversity, amount of diversity, to have a drug for every single person. But what we will get into, hopefully very soon being on the scale of the next 10 years, is to say, okay, now you have a very dangerous disease, or something simple, either of those two extremes. So it may be a headache, it may be a cancer. And you get one shot at a drug in the cancer case. In the headache, okay, you just prefer to have the first drug work. And I'm going to say, take this one, not that one. That is a clear effect on the bedside. Because the probability of the first drug being successful is increasing. And that is something I believe in. Maybe I'm too optimistic on this, too naive, but clearly I believe in this.